Hi, good afternoon. My name is Zoe Grover, and I'm the Executive Director of PAARI, the Police Assisted Addiction and Recovery Initiative. We're going to get started. So, since we know that not everybody in this room knows about PAARI, we wanted to give you a quick history of the organization and what we do. In 2015, there were several fatal overdoses in the small town of Gloucester, Massachusetts. The police chief there met with community members and he asked, how do we solve the overdose problem? The community said they needed access to treatment. So he went on Facebook and he said, starting June 1st, anybody who walks into my department with or without drugs and paraphernalia that is looking for help will be partnered with a volunteer angel who will sit with the person while we try to place them into treatment. The chief called it the Angel Initiative. He posted that on Facebook and went to bed. When he woke up the next day, thousands of people had seen his post and people from all over the country wanted to help. So he partnered with community members to start the Police Assisted Addiction and Recovery Initiative, PAARI. This was the beginning of a nationwide movement. Within a year, over 100 police departments had joined the PAARI network. And today, there are more than 700 police and public health departments across the country that are employing a growing number of tactics to reduce opioid and polysubstance use epidemic. Some folks are probably wondering, why would police be getting into a public health crisis? As you probably know, police have a front row seat to the opioid and addiction crisis. They're the ones responding to calls at all hours of the day. When police engage in community policing, they implement new ways to increase safety and health of the community. Deflection and diversion, which are terms for this type of work, are community policing. Police and public health partnerships are vital to developing and implementing these programs because public safety is still responding to public health emergencies, and an estimated 20% of police calls are related to mental health and substance use disorder. Now on to opioid settlement funds. So why are we in this work and why are we presenting on opioid settlement funds? We're going to tell you that PAARI programs are specifically listed in the approved use of opioid settlement funds. So we became experts to help our partners, but we also want to help anybody who's working in the space to help them access these funds. So about the opioid settlement funds, the Master Opioid Settlement Agreement creates a huge opportunity to expand and support treatment and recovery. The funds are the result of a settlement that included the first settlement included $26 billion in an agreement with AmerisourceBergen, Cardinal Health, McKesson, and Johnson & Johnson. And in addition to that, there's been about $29 billion in other settlements that were received from other sources. All 50 states and territories and thousands of local governments have signed on to this Master Settlement Agreement. So in the Master Opioid Settlement Agreement, it has Exhibit E, which we encourage you to look over. It lists core strategies. And so these are some of the core strategies. I don't know exactly what work you do, but some of the ones that are relevant to our partners are naloxone distribution, medication-assisted treatment or medication for other opioid-related treatment, pregnant services for pregnant and postpartum women, treatment for incarcerated population, warm handoff programs. These are all things that could be funded with the opioid settlement funds. So under those core strategies, there's also approved uses. So some of the approved uses are, again, treatment for opioid use disorder, supporting people in treatment and recovery, funding for first responders, leadership, planning, training, research. We like to point out that PAARI programs are specifically listed as an approved use of opioid settlement funds. So if you're a police department and you're interested in using the funds or in accessing the funds, PAARI programs are specifically listed as an approved use. So that would be an approved or a way that is okay to use those funds is to support these deflection programs or diversion programs. You're probably wondering, so there's this $56 billion of funding. How much is my state going to get? So here we have the percentage that each state is going to get. So here's the first half of the alphabet and the second half. And so you're kind of thinking, New Mexico, 0.856%. That's not very much. But if you look, we have some examples to show just how big of a number that is. So in New York, they're going to get 5.39%, and that's $1.4 billion. In Vermont, a much smaller percentage, 0.284%, but that ends up to be $73 million. And so one thing I didn't mention is that these payments will be received over the next 18 years. So I think at this point, they're already 3 years into payments. So we're in our year 4. So, that 73 million is over the 18 years. Each state has decided to divide the money in a slightly different way. So some states are giving the money to a fund, which is run by like a board, and they'll distribute the money. Some states are holding the money with the state. So maybe the Department of Health or, another department under the state. Some states are giving the money to the local government, and then some states are giving it to a revolving fund. So if you look at the orange states, those are states that have divided the funds between roughly equivalent between state government and local governments. The ones that are kind of that light blue color are they are giving over 70% to the state. The aqua-ish color is over 70% to local governments. The dark blue is or darker blue are the states that are giving over 70% to a fund. And then the striped states are a mix between state, local, and a fund. And then finally, Oklahoma is on its own over there, and it has given most of it to a revolving fund. And then Iowa and Massachusetts are kind of alone on an island as well, and they're dividing the money between local governments and a fund with no money going to the state. So from the information we know that there's 8 states in the South that are part of this ROTA group. So we wanted to just quickly go over what your state is doing. And then we will, at the very end, we're going to link to a guide that has all of this information in it. So you're welcome to, peruse this at your own leisure. So just really quickly, in Alabama, the state is dividing it between a fund, and 50% is going to the local governments. And it's about $886 million of the 54 billion. In Florida, we have 15% going to city and counties, 30 to 40%, it's a sliding scale, is going to a regional fund, and 45 to 50% is going to the state. Again, that's also a sliding scale. In Georgia, 35% is going to the state, 40% is going to a regional fund, and then 25% is going to local governments. In Kentucky, we've got the funds divided 50% local, 50% to the state. That's an easy split of the 1.1 billion they'll be getting. In Mississippi, 15% will go to the state, 15% will go to local governments, and 70% will go to a fund. And North Carolina is a little different. They've got 80% going to the local government, 15% going to the state, and 5% going to a county incentive fund. And again, if you're wondering, like, what is that? We'll be sending around the guide, and there'll be a link to it at the end where you can read more into your state and figure out exactly what your state is doing. In South Carolina, they're giving 85% to the local government, 15% to the fund. I know Liz is going to speak next about what exactly they're doing in their state and show you some of the best practices of these states. And then a final state that I'll talk about is Tennessee, which they'll have 15% to the state government, 15% to the local government, and 70% to the fund. And now I'll pass it off to Liz, who again is going to talk about some of the best practices of using these funds and kind of show some examples of what different localities are doing with this money. Liz?
Thanks, Zoe. So I'm just going to touch on a few barriers to distribution that we are seeing. The first and main one being a lack of knowledge of folks who are making these decisions on where this money should go. We have heard about folks not knowing much about the opioid crisis in their area and what harm reduction tools already exist locally. And they often also do not know what the community needs in regards to the opioid crisis. Another barrier that we have started seeing is the incorrect use of these funds and the lack of enforcement mechanisms for spending the funds. And then a barrier that I will touch on a little bit is that some states are not required to publicly share their spending information. However, 29 states do have reporting requirements in their memoranda of agreements. And then in the overall agreement, it does say that participants must report to the settlement fund administrator any expenditures that are not directly related to addressing opioid issues. So that settlement fund administrator does have that knowledge. However, it is not public. But again, each state differs in how they handle their reporting requirements. And then, as always, there is a risk of community or PR backlash with any spending of this caliber. So it's just something to keep in mind when you're making decisions about these funds. Another thing to keep in mind is that there is a want and a need for community to be involved with the planning for distribution. We suggest increasing community input and offering a call for proposals. There are a few quotes here from local publications that say Mark Romano, Director of Operations for Preventions Plus of Burlington County, said that he wished that there was a call for proposals for using the money in his area. And the Wisconsin Department of Health Services developed its plan in a thorough process that included roundtables across the state with people on the front lines of the opioid epidemic. So those are kind of the two opposites there, that one county really wished that they were doing this, and the Wisconsin Department of Health was actually doing it. I have included an example here of a very transparent process. In Iowa, they created a request for funding, or RFF, process, where all the steps of the process were shared with the public. They offered a Q&A for any members of the community to submit questions, and then all steps after that were public as well, including if they got approved, and if they did get approved, when the project would start and end, and goals within that timeline. We did want to bring it to your attention that it is important to either make these decisions thoughtfully or urgently. There are a few comments here from areas across the US about how they think that these processes should go. In Iowa, their local news read that the money is just sitting there should not be an option for them. And the Wisconsin Legislators Joint Finance Committee has objected to their plans for these funds for 3 years in a row. However, as discussed, there are barriers to making quick decisions, such as waiting on community input. Like I discussed, setting up those roundtables across your state, or creating those requests for funding processes. And then the need for more guidance on how to appropriately use and establish these funds in the community. An article from the NPR actually said that the slow pace has frustrated some advocates who say there should be a greater urgency at a time when the drug supply is becoming increasingly deadly. But others say that the money will continue to arrive through 2038, so setting up thoughtful processes now could pay off for years to come. So we just kind of urge you to make either these processes very thoughtfully, or urgently, to get this money in the hands of the right community folks. Lastly, another thing to remember is to try not to use this funding to replace already existing funding. There have been many examples of this, of using this money as replacements. In one state, they spent more than $250,000 of their settlement money to pay for their health director and EMS staff salaries that was already covered under existing funding prior to. And then in another, their proposed budget substituted millions of opioid settlement dollars for a portion of their state addiction agency's normal funding. And an example of established funding in one state was that they allocated over $300,000 to a drug court the county had already been operating with other sources of money for more than 2 decades. So we advise that you do not apply for projects that could be funded in other ways, because this funding can be very important and very beneficial for your community if used to not substitute for these funding. I'm very quickly going to show you how to see where these funds are going by state. There are a few states that do not share this information with the public. Alabama has a 2023 annual report, but no dashboard like the ones I'm going to show you. Again, Tennessee, they share their fund award grantees publicly, but no dashboard. South Carolina has a public list of recipients and their award amounts. And Mississippi actually does not share any of their expenditures publicly. Georgia does not require awardees to publicly report expenditures, but they say that resources are being utilized appropriately by the state. but they're just beginning to develop the necessary infrastructure to administer the settlement funds. As of now in Georgia, they say that no funds have been dispersed from the trust, but local governments are still in the process of appointing regional advisory council members. However, there are a few states that do have these public dashboards, such as the one you're seeing now in North Carolina. You can see an image here that shows what this dashboard looks like. You're actually able to, on the website, to hover over each county and then get more detailed information on what they're doing with their allotted amount of these funds, where they're going, award grantees, and just more specifics on the core strategies. And then in Kentucky, they have an almost identical dashboard to the one of North Carolina for these funds. Reports are shared publicly by county. And again, you can hover over each county and click and get more information. And then in Florida, they actually have a very, very comprehensive dashboard. Their dashboard shows core strategies, approved uses, spent funds, awarded funds, and award recipients. It is a great example of transparent reporting, and I do urge you to go look at their dashboard to kind of see what states are doing with this money. I also wanted to give a few examples of concrete spending in a state in your area. In Greenville County, South Carolina, there is a partnership between the Greenville County Sheriff's Office, Rise Prevention Incorporated, Just Say Something, and Safe RX. And they started this Power Collective a few years ago. This collective was made to provide education, awareness, prevention, and intervention services to Greenville County schools, businesses, and churches. And opioid settlement funds have been approved to expand the resources of the Power Collective because it was already established. And another example is also in South Carolina in Greenville City. They actually got approved for the creation of what they are calling the Quick Response Team. The QRT team will be under the operation of the local fire department, and they will use a combination of education, preventative outreach initiatives, and emergency responses to remediate the impact of the opioid epidemic in their city. Again, opioid settlement funds have been approved to create the quick response team, so we should get some more information about that soon, hopefully. And just to recap, there are barriers to distributing these funds. However, there are ways to allocate this money appropriately. Remembering to increase community input, make decisions thoughtfully and urgency, and then try not to replace existing funding will help these funds really benefit your community. I'm going to pass it back to Zoe to close us out.
Great. Thank you so much, Liz. So just like I said at the beginning, we do have a opioid settlement fund guide. It's on our website. If you scan that QR code, it'll take you to our website with the page to look at that guide. And again, it has for each state, you'll find allocation amounts and distribution, relevant legal agreements, who's controlling the money, contact information, and important resources within the state. And we do update that guide regularly, again, free on our website. And our final slide is we just wanted to invite you to reach out. If you have other questions, you can reach out at info@paariusa.org, or we'll answer questions live. And also, if you're just interested in learning more about our work or whether or not departments in your state are engaged in deflection programs and helping people connect to treatment and recovery, check out our website. It's paariusa.org, so PAARIUSA.org. And we're very excited to be here today, and we can't wait to answer your questions. Thank you.